Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here. Today we will discuss about UB4 claim form in medical billing. Generally, this UB stands for Uniform Billing, and this claim form is used by hospitals and institutional providers, and some other facilities or some other facility providers are using this UB4 claim forms to submit their providers treatments to the insurance companies. I mean, to submit their provider medical claims to the insurance companies to get the payments. So that is why it is known as a hospital billing claim form or institutional billing claim forms, and also we can call it like a facility billing claim forms. So before that, we have to understand that this UB4 claim form 04 claim form is also known as a CMS 1450 claim form, and totally this UB4 claim form has 81 field locators or boxes or form locators. Total boxes available on UB4 claim form is 81 boxes available. So now we all of you discuss about field locator 8 to 17. This field locator 8 to field locator 17, we have patient demographic information or patient related information. So and I want to add one more point. UB4 claim form is developed by Centers for Medicare and Medicaid Services CMS, and they follow the CMS guidelines, and also it is published by National Uniform Billing Committee, and also they will follow the NUBC guidelines also. So some codes are which are used in our UB4 claim forms are decided and designed by the NUBC National Uniform Billing Committee. So we have to understand that before we are learning this UB4 claim form or we are filing this UB4 claim forms to the insurance companies, we all of you know that what are the NUBC guidelines and CMS guidelines regarding this UB4 claim forms. Okay guys, now we are discussing about field locator 8 or form locator 8. This field locator 8 is telling about patient name, and here 8A is not required. 8B we have to enter the patient name, and so patient last name, patient first name and middle initial we have to enter in the 8B box, sub box of 8B. So this is about field locator 8. And also I given one point: when submitting claim for a newborn baby using the mother's ID, you have to enter the infant's name in 8B. If the infant is unnamed, and write the mother's last name followed by a baby boy or baby girl. If the baby is a boy, then you should have to enter mother's last name in 8B followed by a baby boy. So if the billing for multiple births, like use twin A, twin B, etc., then we have to enter the like twin A comma twin B, but it should be entered in a united commas like twin A comma twin B. In that format we have to enter the names in the field locator 8B sub box. Okay guys, now we are discussing about UB4 claim form field location 9. It's 9FL is telling about patient address, and example here 9 is telling about complete patient address information, and the sub box 9A we have to see the address line of that particular patient, and 9B sub box is telling about the city name, the way the patient is living, and 9C is about the state of the patient, and the sub box 9D is telling about zip code of that particular area. So this is about the patient address information in the field location 9 on UB4 claim form. Okay guys, we can see the field location 10 is telling about patient birth date. So we have to enter, or we can see the patient date of birth in 8-digit format like month, date and year format. Okay guys, field location 11 on UB4 claim form is telling about patient sex, like it is a male or female information we can see on box number 11. Okay guys, here field location 12 on UB4 claim form is telling about admission date, patient admission date. So we have to enter the patient admission date, on which date patient is taken admission to the hospital. We have to enter that particular date on the UB4 claim form on a box number 12, and also we can see that information on a box number 12. Okay guys, here field location 13 is telling about admission hour. So we have to enter particular hour of a patient admission, at which time of hour the patient is admitted into the hospital. That hour is known as a admission hour. So we have to enter that particular hour in admission hour. So how much time the patient is admitted in a hospital, that particular hour is known as a admission hour. Okay guys, now we are discussing about field location 14 on UB4 claim form. This is telling about admission type, patient admission type. So sometime the patient is admitted into a hospital because of emergency situation. At the time we have to enter here in field location 14. The type is 1. Here 1 is telling about emergency, 2 is telling about urgent, and 3 is telling about elective. Fourth type, if your type is 4, you entered in field location 14, it is telling about newborn baby or girl. So it is like that, we have to understand that based on the number whatever you given on a field location 14, we can understand the type of admission of that particular patient. Okay guys, here the field location 15 on UB4 claim form is telling about admission source code. If the patient was transferred from another facility, enter the numeric code indicating the source of transfer. Some example of SRC are given below. So here the source code is known as a SRC code. Generally, on field location 15, we can see like for example, the admission source code is a clinic, doctor's clinic. We have to enter the 2 in a field location 15, and for example the source code is emergency room of doctors, in the hospital. At the time you should have to enter the source code in on field location 15 on UB4 claim form. You have to enter 7. It is telling that emergency room. Okay guys, here the field location 16 and UB4 claim form is telling about discharge hour. So for example, at what time you are discharging from the hospital, that particular time of hour you should have to mention. For example, 12 noon, if you are a discharged from the hospital, you should have to enter in the field location 16. Then number is 12. It's telling about it is a discharge hour. So for example, you are discharging from the hospital from the 9 p.m. on evening, then you should have to enter the number on field location 16 as 21. So it is telling about discharge hour of that particular patient of a time. Okay guys, now we are discussing about the field location 17 on UB4 claim form. It is telling about the status of that particular patient at discharge. So discharge status, for example, patient is discharged to hospital based swing bed, then we have to enter the 61 on field location 17. And if the patient is moved to nursing home facility, we have to enter the 64 in the box number 17. So if the patient is discharged to critical room area or access hospital area, then we have to enter the 66 on a field location 17. So this is about a patient discharge status of that particular service. Hey guys, thank you for your time. If you felt content is useful, could you please like our video so that it will reach us many more needy people. Thank you for watching. Have a good health. Bye.